Well, thank you guys for coming. We're glad to have you. This is our first in what we plan to be a series of probably quarterly little learning sessions, and we'll have a different topic every time. At the end, I'm going to ask you to fill out a short little evaluation and kind of tell us what you liked, what you didn't like, what topics you might want to see in the future so that can help us plan better. I want to introduce a couple of people to you. Obviously, most of you know Dr. Harper already. And I don't know if you've all had a chance to meet Dr. George. Wave for us, Dr. George. Dr. George joined us last summer and has been an outstanding addition to the practice. And because we have two doctors, we're now able to be open extended hours and be open Monday through Friday. So if you didn't know that, Monday through Friday, 7 to 6, we're here. So you can come early before work or later in the afternoon or whatever. So that's been great. And then they kind of split their days. So, you know, Dr. Harper's here Monday, Tuesday, Wednesday. Dr. George is here Wednesday, Thursday, Friday. So there's always somebody that can take care of you if you have a dental emergency or a problem. And then I want to introduce Glenda. Glenda Meadow is our treatment coordinator. She's been with us since we started Total Dental Care, and we're so glad that she has stuck with us and put up with us. But she handles all of our financial arrangements, our insurance, billing, and just all of that kind of stuff. So if you end up wanting to talk about an implant, Glenda would be the person that would help you on that part of it. So I'll let her get back to work. Thank you, Glenda. Feel free to get up during the presentation. Chris has prepared a little PowerPoint. It's probably no more than 30 minutes. And then we'll have a question and answer time at the end. But feel free to get up and get more drinks or food. There's a restroom up here just straight out this door and to your left. If you need to use that, feel free. Any questions? All right, well, let's get started.
Well, good. Well, thanks for everybody for coming today. We're calling these series Increase Your Dental IQ. Like Carol said, we're going to kind of vary our topics and just according to what our patients, what our friends want to know. So at the end of the presentation, if you guys could please fill out those little forms, we'll be glad to address anything that you have. Like Carol said, this is a very informal presentation. You guys will figure out real quick. I'm definitely not a professional presenter. I want this to be more of a conversation. If there's a question that you guys have, or if there's something that isn't quite clear, please bring it up. I definitely want to know if there's something that doesn't make sense. This is our practice, Total Dental Care. A little bit about myself. This is a picture of me, Carol. Carol is my wife. You guys seen her. And this is my daughter, Mandy. She is a sophomore at Alabama. Trying real hard to get her interested in dentistry, but so far it's not really working. But I have been in practice for about 7 years. Every dentist in the state of Alabama has to complete what's called continuing education. The average dentist gets about 20 hours of continuing education every year. I average over 100 hours of continuing education every year. The reason that I do that, I want to be able to provide the best dental care possible for my patients. My goal here is to be able to provide world-class dentistry right here in our small town, and so far we're doing it. Definitely not saying anything bad about any of the other dentists in this area, but a lot of the things we do here in our office, if you need a dental implant, if you need a root canal, if you need surgical extraction or wisdom teeth extraction, most of them are going to refer you to Gadsden, Coleman, Birmingham, or Huntsville. We can do it all right here in the same location. And a lot of the procedures that we do requires 2 or 3 things to be happening at the same time. And if they're referring you to Huntsville for your fill-in-the-blank root canal or whatever, we can do it all here. Hey, come on in. Today we are talking about dental implants. I've put this figure came, it was about a year ago, we figured out that I'd done between 500 and 600 implants. I'm sure I've done more than that now, and definitely not saying that to brag or anything, but I'm saying that just to let you know that it's become a very routine procedure. We do implants almost every day here. Back when implants first came out, and we'll talk about the history of implants in a few minutes, but back when they first came out, an office would pretty much shut down for the whole entire day. They would only put in 1 implant. 2 days this week, we put in, I think, 2 implants on each day. The patient was in and out in probably 45 minutes or an hour. Very simple process. I wish I could take credit for all of that, but the current technology, the current procedures have made things so much better and less expensive. We'll talk about that later too. But like I said, I've placed about 500 or 600 implants. I'm just pretty much overall nice guy. I put that in. The first question that people usually ask is, what is a dental implant? It's a small titanium post that is shaped just like a tooth root. Most of you guys have seen what the shape of a tooth root looks like if you've seen a tooth that's been pulled. But I have a great little model here, and we'll watch a little video about it in a second. But the implant is shaped just like a post. It goes right down into the jawbone. It's not nearly this big. This size is big enough for one of my teeth. You guys notice that I have big teeth, but the real size of an implant is about this right here. And we'll watch a video about it here in just a second. But that's what goes into the jawbone. It's amazing. The bone doesn't have any nerve endings, so the bone doesn't feel any pain. The gums are the only thing that has nerves. So whenever we put in an implant, just about every time I put one in, I call the patient at night and ask them, how are they doing? There's been quite a few times that they tell me they've never even taken any pain medicine. It's amazing. But after we put the implant into the jawbone, we do have to let it heal. After that, we have a little post made. It gets screwed right in. And then depending on what we're going to do from that point, whether it be a crown or whether it be a bridge or whether it be a denture, it's made to snap right in. It's amazing. Next question I see is, why do we need dental implants? There's a lot of things we can do. I'm going to show a quick little video here about why dental implants are so important.
When several teeth are missing, implants can be a good choice for replacing them. Implants are small titanium posts that replace the roots of missing teeth and support custom-made crowns and bridges. Implants can prevent a chain reaction of problems, including loss of bone in the jaw, shifting teeth, difficulty keeping teeth free of plaque and bacteria, grinding and clenching, and pain in the jaw joints. Teeth transmit chewing forces through their roots to the jawbone, and this provides the stimulation bone needs to stay healthy. So when teeth are missing, the jawbone around the area begins to shrink, along with the surrounding gums. Missing teeth also change the biting forces on teeth around the space. Neighboring teeth begin to shift, and the opposing teeth begin to extrude out of their sockets. These changes create places around the teeth that are hard to keep clean, so plaque and bacteria quickly accumulate. This accumulation can cause tooth decay and periodontal disease. Changes in the bite can also put improper chewing forces on the shifted teeth, and this may lead to grinding and clenching and painful problems with your jaw joint, the TMJ. To determine if implants are right for you, we'll do a thorough exam, which will include recording your medical history, performing a visual exam to check the health of your teeth and gums, taking panographic or panoramic x-rays and possibly CT scans to check the health of your jawbone, and taking impressions and bite registrations to create an accurate model of your mouth. Implants with crowns or a bridge replace missing teeth, and they're a great way to keep your jawbone healthy, maintain a stable bite, and restore your beautiful smile.
And even though that guy looks like me, that's not me. That's me plus about 50 pounds. Everything makes sense so far, you guys? Good. Like I was saying, we can use dental implants to replace a missing tooth or multiple teeth. A lot of times we use them to support a denture or a partial denture. I want to show you guys a video about a denture, and I promise you this is not to make fun of people that wear dentures. But if you guys know anybody that wears a denture, I guarantee that they are worried about some of these same things. During this presentation, I'm going to show 3 videos, and they're funny, but like I said, it's not to make fun of somebody that wears a denture, okay? But I guarantee that people that wear dentures are afraid of this happening. You kind of have to pay attention here. like I said, not to make fun of dentures, but they're very, dentures are one of the most complicated, one of the most frustrating things for patients to get used to. It's also difficult for the dentist too. But you know, you guys saw the woman skydiving, smiled real big, and her denture flew out. So people that wear dentures, I guarantee they're worried about hearing a funny story or being at church or work and, you know, laughing and their denture falling. Nowadays, we can help with that. There's a lot of options that we can do. We'll talk about that in a few minutes. A lot of people that wear dentures use what's called dental adhesive. You guys might have heard the terms Fixodent or Polydent. There's a lot of dental adhesives that are used. There's a lot of research that's being done now. The main ingredient in dental adhesive is zinc. Zinc has been linked with cancer and certain neurological diseases also. So a lot of the newer materials are coming out that don't have zinc in there, but they're not working nearly as well. So we see more and more patients that are coming to us for a more permanent solution that we can help them with. So we can definitely do that. How long have dental implants been used? They found a skull from the year 600 AD, had three little pieces of shell shaped in the piece, or shaped, you know, in the shape of a tooth, hammered into somebody's jawbone. So they've been doing dental implants for a long time. Officially, the type of implants that we do now we've been using them for about 50 years. Dentists have been using them for about 50 years in the United States. Believe it or not, Alabama was very important in the early days of implant dentistry. There was a group called the Alabama Dental Implant Association down around Birmingham. People from other states actually came here to learn about dental implants. And even at UAB Dental School, that's where I went to dental school. There's a researcher on dental implants down there called, his name is Dr. Lemons, and he is one of the worldwide authorities on dental implants. So they're very, very safe. They've been very well studied. We know they work. We know what guidelines to follow to ensure that they work. And we'll talk a little bit about how long they last because of those rules. How do we decide what size of implant to use? Remember earlier I said they have different lengths, they have different widths according to the situation that we're dealing with. But after we finish, if anybody wants to see, I use a very expensive x-ray machine. It's called a 3D cone beam machine. What it does, it allows me to take an x-ray of somebody's head and really just the jaws. It's basically like a CT scan, like a CAT scan. I can go through and I can look at that image from any angle that I want to. I can turn it upside down, inside out. I can look at somebody's jawbone from any angle that I want. It allows me to see the density of the bone, how wide it is, how deep it is, how tall it is. And it lets me decide if a patient is a good candidate for dental implants before I even agree to try to put one in on them. Back in the old days, they used to use it before this kind of technology. They would go in with a scalpel, cut the gums open, kind of pull all the gums back to even see if somebody was a dental implant candidate. We don't do any of that anymore. I don't really ever even use a scalpel. It's amazing. But this is the software that we use. I was saying I can make little slices using the computer, not actually on the patient, but I can see exactly what kind of bone that we're going to be using for our dental implant before I even go in. Usually the implant process takes me about 10 minutes for one implant, if that. So, using the computer, the software that comes with it, there are a lot of vital nerves, and there are sinuses and everything in the jawbone that we have to stay away from whenever we place a dental implant. I don't want to oversimplify the process. It is very complicated, but with the technology that we have, we've made it very simple. What this shows, you see the purple line down here, we can go in and map exactly where the lower nerves are. Those are what we have to avoid. If I put an implant into that nerve, then we have a numb lip for the rest of our lives. So I'm able to see exactly where that nerve is. I can measure exactly how big of an implant we can put. So our goal is to stay away from all that, and we're able to do that very successfully. So, I have a testimonial from a patient that was here about a month and a half ago. This was an older woman. She had never had a dental implant. We had to pull one of her front teeth. She had broken it off at the gum line, and just like I would be, she was nervous about, what are people going to think? They're going to notice that I'm missing a front tooth. So what we did for her, and we do this all the time now, we pulled the tooth, we put in the implant directly. I'll read this testimonial. You guys probably can't see it up there, but she's in her 60s, super nice lady. Could not ask for a better patient, but she was real nervous. She said, on February 19th, 2014, I had an implant put in. I was nervous at first, but Dr. Harper was very careful to explain all the details of the procedure and showed me a video explaining the step-by-step process. I had no pain whatsoever and had no need of pain medicine. All I used was the antibiotic. I am very pleased with Total Dental Care and Dr. Harper. That's pretty cool, isn't it? Like I mentioned earlier, I usually don't have to even use a scalpel whenever we place a dental implant. We use a special little rotating burr that just makes a small little puncture in the gums. We put the implant in, usually no stitches, very little soreness afterwards. Usually very little bleeding. I'll show you guys some pictures later of some cases that we've done, and even right after we put the implant in, you can see there's hardly any bleeding whatsoever. It's amazing. Just about every single patient I've ever put one in on tells me they're sore for 1 or 2 days, but beyond that, it's very minimal. The next question I usually get is, how long do they last? As long as we follow the guidelines like I mentioned earlier, they say there's a 98% chance of those implants being with you the rest of your life. That's pretty impressive. I can't say that about really anything else we do in dentistry. We'll talk a little bit later about bridges, but dental implants, as long as we follow the guidelines and as long as we do everything according to the way I'm supposed to, 98% chance of it being with you the rest of your life. One of the types of patients that we have a little bit less success with is somebody that smokes, or if somebody has uncontrolled diabetes. If you have diabetes and never monitor your blood sugar, then they say there's about a 90% chance. With the conventional dental implants that we put in now, I've only lost one ever, and you know, that's pretty good odds. You know, if we're going to put a crown onto the dental implant, or if we're making a denture, or I'll show you guys later, there's little O-rings and little attachments that are used. Those need to be changed out over time. But the implant, the part that goes into your jawbone, like I said, 98% chance of it being with you the rest of your life. So that's amazing. Everything else is just kind of like changing a tire on a car or an oil change. All that's real simple. But just to make sure, I stand behind my implants absolutely. Even if something were to go bad down the road, I stand behind all the implants I put in 100%. So I'm in this for the long haul with you guys. Next question, how do we place dental implants? It's a very simple process. I have another testimonial here. Said, my experience with having an implant was a very good experience. When deciding to have the procedure, I researched it and asked the ladies in Dr. Harper's office, as well as watched a video online. While watching the video was helpful, it also made it seem like an extensive procedure. What made me choose the implant was talking with someone at the dental office that had an implant too. Along with Dr. Harper talking with me, answering all of my questions, and explaining the procedure, letting me know that a 3D image of my bone would be taken first to make sure the bone density was okay to have it done. I was amazed how the technology allowed me to see how and where it was to be placed, elevating most of my concerns. I was a little nervous before the procedure started, but soon realized that it wasn't anywhere near as bad as I thought. During the procedure, everything was explained to me as they went, making me feel comfortable. I left that day with pain medicine that I only needed to take one of that night. Other than a little discomfort and soreness, that was it. The soreness only lasted about 2 days and I was good to go. The implant healed well and I returned for my follow-ups until the day I received my implant crown. I haven't had my implant long, but I'm very impressed and would recommend it to other people. This is showing one of the processes that one of the things that we do. Quite often we'll have a patient come in with a tooth broken off underneath the gum line. And we try to save teeth whenever we can, but there are certain times that we come across where we know that no matter what we do, the tooth is non-restorable. Even if we try to do heroic dentistry on it, it's just a matter of when the tooth is going to come out. When that happens, we make a plan. We can pull the tooth. A lot of times we'll put whenever we pull the tooth, it creates a small conical little hole, right there in the bone. We can put an implant directly in there. That means you only have to get numb one time. You don't have to come back for an additional procedure. It works great. Whenever we do this, I've never had a patient get a dry socket. You guys have probably heard about dry sockets. When we put the implant in, we don't get a dry socket. The gums heal around it perfectly. This is just showing the implant put in all the way into the gum, into the bone. And then after we heal, we'll put the small post. Remember I showed you guys a post and the crown. I want to show you guys a case, and I do have this guy's permission for me to show this. Don't know if you guys know this or not. Every year we have a free dental day to give back to the community. Even though I'm not from Guntersville, Guntersville has been wonderful to us. You guys most of you guys have seen our practice grow over the years. We're very fortunate, very blessed. But every year we have a free dental day to give back to the community. There's a lot of people in this area that are way less fortunate than we are. There are people that are borderline homeless. Every year we do this. We've had people come in that have never been to a dentist their whole life. We do fillings, we do cleanings, and we do extractions for them. Sometimes people may have been on drugs, people have made bad decisions, but we try to do everything we can to give back to the community. We usually treat 50, 60, this year we'll probably treat 70 or 80 patients, and we don't charge anybody a penny for that. We do it just to give back. We treat it like it's a big party. We treat the patients like they're our best patients in the world. So it's a great day. But this is Alan. On the first year when we had our free dental day, he came in and you can see his teeth are pretty decent, but he was missing a front tooth. I think he'd gotten in a fight. I don't know what happened. I didn't really ask any questions, but like I was saying, he had not been to a dentist in a long, long time. And he asked me, I don't know how he knew about dental implants, but he asked me, how much would it cost to put in an implant here? And I told him, I was like, well, yeah, probably about this much. And he left. I think we cleaned his teeth that day. Well, about a year later, we get a call from Alan. And he's like, hey, this is Alan. I was there for your free dental day. I finally have my money. So he came in and just really touched all, everybody, all the staff, they all loved him. You can see, even though he was missing a front tooth, it didn't really affect his personality at all. He still laughed, smiled, carried on with everybody. This is the day that we pulled the tooth. We put the implant in directly. Whenever we do this, we do have a temporary partial made that makes it so that patients don't have to go around without a front tooth. It didn't bother him too much, but I'll show you another case in a second that I'll show you a picture of the temporary partial. Nobody can tell that it's not your regular teeth, but the picture on the right is showing the small little post that sticks out of the gum so we can put a crown on there. But missing a front tooth, not anymore. And you see he's pretty happy patient there. So I think these cases, they're wonderful. I'm not going to say I ever cry, but patients cry. I have shed a tear. This is really, really amazing. This is another really neat case. This is a very beautiful girl. She drives up to us to see us from Gadsden. Her front tooth, the same one right here in the middle, it had broken off at the gum line. For I don't know how many years, she had been super gluing that tooth back in. And she came to me, horrible breath. The bacteria, whenever we have a crown that doesn't fit, or if we have a crown that keeps coming off like that, the bacteria that gets up underneath there, the smell was terrible. But anyway, we did the same thing for her. The day that we pulled the tooth, we put in the implant immediately. What you can see here, the metal it's called a metal heal. It's a healing cap. It's made of titanium. It sticks out of the gum just a couple millimeters. And what it does is it allows us to go back in there later, access the implant, take an impression for the permanent crown without having to numb a patient up again. So the picture on the right here is her wearing her temporary partial, so that she never had, even the day that we pulled the tooth, she never went a single day without having her front teeth. So she was real happy. And so this is her the day. She was numb for some additional work we were doing, so that's the reason her lip is drooping down. But the crown looks just like her other teeth. super happy patient. So broken front tooth, not anymore. So, one of the other procedures that we can do, I was mentioning earlier, sometimes the bone is very narrow, and we're not able, in the past, we were not able to put dental implants in. Well, using the 3D technology that we have, we can see exactly how wide the bone is. There's a special type of implant that I use quite often. If you see down here towards the tip, and like Carol mentioned, that the actual size of the implant is not nearly this big, but the base of the implant, where it goes into the jawbone, is very narrow. That allows me to put it into the skinny little bone areas, and as it goes in, it actually widens the bone. In the past, they used to do some pretty painful bone grafting procedures to try to create enough bone for us to put in. Nowadays, things are so much easier. It's amazing. Usually, no stitches, no cutting, very little bleeding. This area right here, this white area, is just showing a little animated slide here showing a very narrow bone ridge. As the implant goes in, it widens the area. It is very stable, going to be there forever. Also, sometimes on the upper bone, in areas where we haven't had teeth for a long time, the bone tends to go away. I'll show you guys another animation here, but in areas where we haven't had teeth for more than 5 years, in the past, we weren't able to put implants in without doing some bone grafting and even some what's called sinus lifting procedures. Nowadays, we have some short, fat implants that we're able to put right in there without the bone grafting, without having to do the sinus lifting procedures. Up until a few years ago, a process like this might have taken up to a whole year to complete. Now we can complete it sometimes in as short as like 6 weeks. So, I've mentioned this a few times, benefits to the patients: less bone grafting, less sinus lifting, less pain, and shorter waiting periods. Do you guys like these testimonials? Do you like hearing them? Good afternoon, Dr. Harper. I wanted to take a few minutes and convey to you how much I appreciate your professionalism and how informative you and your staff have been regarding my new implants. When I made my first appointment, I was totally shocked that you called and talked with me before I had ever met you. That was a first for me. I felt special. When I first came to you, I really didn't know what to expect. It had been years since I had seen a dentist. There aren't enough words to express my appreciation for what you have given back to me. A big smile. The time you spent explaining every detail of implants. I left my first visit truly impressed with your state-of-the-art equipment, especially the 3D imaging. My second visit involved the placing of the implant post. I dreaded that. However, it was virtually a pain-free experience. I only experienced slight pain the first day. In parentheses, that's what you told me would happen. Ye of little faith I am. The whole process has been virtually pain-free and very educational. I anxiously awaited getting the molds made and now getting my dentures. I feel very fortunate to have found you, thanks to Sandra. She's one of my dental hygienists. My only regret is that I waited so long. Thank you for providing a great service to our community.